Greetings and thanks for tuning in today. My name is Dr. Jeanette DeWitt. I'm a doctor of physical therapy and I specialize in medical massage and performance coaching, but what I really focus on is people who are active yet not as active as they would like to because of headaches, migraines, jaw issues, neck pain, and back pain. So that may seem like a lot, but it's all spine and head related. And a lot of times something in your pelvis might be throwing off something in your neck and vice versa. But today, the purpose of this video is to share a little insight about one of the major headache and migraine muscles. And if you are experiencing increased headaches and you're blowing it off as, oh, it must be the sinuses, it must be the change in weather, I am here to tell you that it could be that, because weather can be a trigger for headaches and migraines, but it could also be neck tension and your posture, like just a host of everything that can happen. So tightness, posture changes, weather-related changes, and just a quick side note on the weather, the reason that you tend to feel more achy or sore or headaches, migraines during the seasonal changes is because when the atmospheric pressure changes outside, your body has to stay in homeostasis. And what that means is you have to stay in balance. Your lung pressure has to stay at a certain amount of pressure, and it will do everything it can as a survival skill to maintain the lung pressure. And that means that you have increased blood flow, increased inflammation, decreased blood flow, a lot of fluctuations in circulation. And headaches and migraines in particular are what we call a neurovascular disorder. So for migraines, what I mean by that is neurovascular is nerve and blood flow. And when those two are put under stress, you can start experiencing more migraines and headaches. So what I want to show you for today's purposes is if you feel like you have a question mark on your face or on the side of your head, that means you feel like, oh my gosh, in the shape of a question mark, just right along here, over the eye, into the cheekbone, even along the ear, this muscle here, big fancy muscle called the Sternocleidomastoid muscle, it can have trigger points in it. And when it has trigger points in it, that's the X's, it can refer symptoms to the cheek, to above the eye, to the top of the head, to the back of the head. But the big classic symptom or sign of this muscle being under trigger point is this question mark type pattern in your symptoms. And so what that means is you can see this muscle, I'm trying to get into a position, there it is right there on this side. When it rotates the head to the opposite side and it flexes the head to the same side. So this muscle here, it's a big muscle that crosses the neck, and that can wreak havoc on your head and neck symptoms. So what can we do about it? Well, first of all, we can stretch it, and that will help to elongate that muscle. The other thing you can do is see a specialist like myself and get trigger point releases. And that sometimes, if stretching doesn't work, you often have to release the trigger points so that the stretch can be effective. So if that's you and you try this stretch and you're still having a lot of migraine headache issues, just DM me and reach out, because I can help you get some relief and also prevent them from coming back. So how do we stretch this big fancy sternocleidomastoid muscle, which we just call it the SCM muscle because that's easier to say. But what we want to do is stretch it. So what I said before is this muscle is an opposite head rotator and a same side neck side bender. So what that means is that when you turn your head to the left, you are actually working that muscle, but we want to stretch that muscle. So to do that, we actually have to rotate to the opposite side and side bend to the opposite side. And now we can get a stretch. And if you feel a stretch through there, then, and that's good, you want to just stay there. If you don't feel much of anything, you want to make sure that you are in good posture so that your shoulders are back and down. And then you can take your hand, and on the same side that you are looking towards, you're going to give a little arm tug. Now you should feel that a lot more, and you're just going to hang out there for 20 to 30 seconds, breathing deeply and letting that muscle realize that, oh, I can actually be in a lengthened position. Because one of the things that trigger points does is it shortens the muscle. And when it shortens it, now that muscle is not in its optimal position. And that is when it starts to give you some symptoms. So we're going to release that, and then we're going to do the opposite side. So same thing, you rotate, side bend, and give a little bit of a pull. And you only give the pull of your arm if you don't feel it when you first rotate and side bend. So we're just going to hang out there. And if you're feeling this a lot, just back off on the pressure that you're giving that pull to your arm. But it's super important to just relax and breathe and then slowly come out of that. So you could do 1 for 30 seconds. You could do 2 to 3 for 30 seconds. You could do every hour on the hour, get out of the computer position and try that stretch. But this is one of those stretches that really you can do as often as you would like, as long as you are being gentle with your stretching. So again, just to kind of recap, if you are experiencing headaches or migraines with this question mark type pattern, it is typically this big fancy sternocleidomastoid muscle known as the SCM, and we can start to stretch that. But if stretching and stretching and stretching doesn't work, you probably have some trigger points in there like the X's on that diagram, and you need some physical intervention. This is a muscle that is very hard. If you don't know what you're doing, it's very hard to actually release the trigger points, because we don't want you pressing around here. That's your carotid artery. You got the vertebral artery. You've got different nerves coming through here. It's very sensitive. So it's not one of those muscles that you want to be digging on, that you want to be really aggressive with. You have to be careful, and you have to go to a professional to get those released. Just so that you're not, pushing on arteries and nerves and creating other issues with that. But from a stretching standpoint, you're going to rotate to one side, side bend to the opposite. If you feel a stretch, you can stop there. Give a little bit of a tug. If you don't, hold for 30 seconds, gently come out of that, and then do the opposite side. Hold for 30 seconds, and then come out of it gently. So now, one question I get with this is, should I do one side 1 to 3 times for 30 seconds and then switch, or should I alternate between the two? Honestly, that is up to you. You can decide. You can try it both ways and see which way your neck prefers to respond to the stretching. And the reason I say that is sometimes we personally have a preference, but sometimes our body has a different preference. So we have to listen to the body and follow what the body is saying, because the body is telling us what it needs. And when it's telling us what it needs, we don't want to fight that. We want to work with it. So I hope this helps. I hope that, again, if you are experiencing headache symptoms with this question mark type pattern, you focus on some stretching with the sternocleidomastoid SCM muscle and find some relief. If you have questions, if this stretch is just not doing it enough, you probably need a little bit other intervention, reach out to me and I'm happy to help. Thanks a lot and have a great day.